General adult tests checking blood cholesterol. Cholesterol is a fat-like substance carried in the blood. Some cholesterol is vital for normal functioning of the body, but too much of a certain type may increase your risk of developing health problems such as heart disease and stroke. Cholesterol plays a vital role in many body functions, such as making hormones, producing bile to help digestion, and keeping cell membranes flexible but firm. About 90% of our cholesterol in the body is made in the liver. Only a small proportion comes from the diet. Cholesterol is carried in your blood attached to proteins, in particles called lipoproteins. There are two main types of these: low-density lipoproteins, LDLs, and high-density lipoproteins, or HDLs. Triglycerides are a type of fat in the bloodstream. When you eat more calories or energy than you need, the excess energy is converted into triglycerides by the liver, then stored in body cells. High blood levels of triglycerides are associated with an increased risk of cardiovascular disease, which is why it is important to measure blood levels of triglycerides as well as cholesterol. Low density lipoprotein, or LDL, containing a relatively small amount of protein and large amount of cholesterol. LDL particles carry cholesterol from the liver to the body cells. LDL can deposit cholesterol on artery walls, forming fatty plaques that reduce blood flow, which is why LDL is called bad cholesterol. You can check your cholesterol yourself with a home testing kit. This uses a special reactive strip on which you place a drop of blood from a finger prick. The strip is then inserted into an analyzer, which gives the results within a few minutes, as well as a total cholesterol level. Some devices also measure HDL, LDL, and triglyceride levels and calculate the HDL to LDL ratio. Alternatively, there are home tests in which you send off the strip or a blood sample to a laboratory for analysis. Some pharmacies also offer blood cholesterol tests. The results should be considered in combination with other risk factors for cardiovascular disease, and appropriate medical advice should be sought. High density lipoprotein, or HDL. HDL particles contain relatively more protein and less cholesterol than LDLs. HDL helps to remove cholesterol from fatty plaques on the artery walls and carries the cholesterol to the liver for removal from the body, which is why HDL is known as good cholesterol. Cholesterol cycles between the liver and blood in two forms: HDL and LDL cholesterol. If there is more LDL than HDL, circulating fatty plaques can build up inside arteries. HDL acts to reduce plaques and return cholesterol to the liver. Cholesterol levels are measured by analyzing blood obtained from a finger prick or by taking a small sample from a vein in the arm. You may sometimes, but not always, be asked to fast for 8 to 12 hours before the blood sample is taken. If you are asked to fast, you should not eat or drink anything apart from plain water. You may also be asked to stop taking certain medications. If in doubt, consult your health professional. The blood sample is analyzed for HDL and LDL cholesterol levels, and often also for triglycerides. The HDL and LDL levels enable the total cholesterol and the total to HDL ratio to be calculated. Together, the results give an indication of your cardiovascular health in relation to your blood lipid level. Unhealthy total cholesterol is above 195 milligrams per DL, or 5 millimoles per liter. Health, unhealthy total cholesterol HDL ratio is above 4. Unhealthy triglyceride is above 205 milligrams per DL, or 2.3 millimoles per liter, non-fasting blood test, and above 150 milligrams per DL, 1.7 millimoles per liter, fasting blood test. The healthy figures are: where total cholesterol should be below 195 milligrams per DL, or 5 millimoles per liter. Healthy total cholesterol HDL ratio is below 4, ideally as low as possible. Healthy triglyceride is below 205 milligrams per DL, 2.3 millimoles per liter, non-fasting blood test, and below 150 milligrams per DL or 1.7 millimoles per liter, fasting blood test. Thank you for your attention.